First of all, it is very important to listen to the patient and her symptoms, because endometriosis can have two main symptoms. First of all, it can be characterized by pain. Most typically, this pain can be present during menstruation, severe period cramps, that can even, in more severe disease, have an effect on the function of the bladder and the bowel, and in some women also cause painful sexual intercourse. Next to these pain symptoms, the infertility history or difficulties in getting pregnant is a second very important symptom of endometriosis, and that may or may not be combined with pain problems. For a physician, the next step after listening very detailedly to the patient's history is to perform a thorough gynecological examination to see or feel any important endometriosis lesions. This is not always possible, since very mild lesions may not be very apparent during clinical examination. So therefore, we can rely further on technical imaging studies, of which the most accessible one would be a transvaginal ultrasound scan. If after clinical and technical studies there is still not a definite answer to whether or not the woman has endometriosis, the last step could be performing a diagnostic laparoscopy, where visually lesions can be identified by performing a minimal access surgery. This is still considered to be the gold standard of diagnosis of endometriosis, although not always strictly necessary before starting a treatment plan for women with suspected endometriosis.